Hello, everybody. I would like to welcome you to today's episode of RainPad Talks. These talks are supported by the company Positrigo, which is a pioneer in nuclear medicine imaging technologies. Ms. Mann is the VP Clinical Development at Ionetix Corporation. Prior to joining Ionetix Corporation, Ms. Mann was the Chief Technical Officer at Martin Imaging. Before entering the industry sector, she was employed by the Hartford Healthcare since 1992, and her roles have included System Manager, Business Intelligence and Data Analytics, Heart and Vascular Institute, Manager of the Cardiac Lab, Non-Invasive Cardiology, Nuclear Medicine, and Vascular Ultrasound Imaging. She has been a nuclear medicine technologist since 1989 and has a BA in Healthcare Management and a Master's in Business Administration. Ms. Mann has been active within the nuclear medicine, nuclear cardiology community, serving as the president, the Society of Nuclear Medicine and Molecular Imaging Technologists section, as well as chaired and served on numerous committees for the Society of Nuclear Medicine Technologists section. She has over 27 publications, including book chapters, continuing education research manuscripts, and has given over 225 presentations on various topics in nuclear medicine, nuclear cardiology, management, and quality throughout her career. Ms. Mann, it's a pleasure to have us with us. The floor is all yours.
Thank you so much for having me today. And I'm hoping in the next 30 minutes or so, I'll be able to provide an overview of all the components that one would need to think of when either starting a PET lab, adding to an additional nuclear medicine facility, or adding one from complete scratch. So with that, I'm going to go ahead and kind of hop right in. So there are several items for consideration when we were building or starting a PET imaging program. First and foremost, you need to understand where your patient volumes are coming from. It's going to be important to build a project plan and pro forma. The other thing you want to identify is what are the goals of the program? What is success going to look like for your practice? Is it a specific patient type? Is it with a specific group of physicians? Do you have a memory clinic or other things that are looking to refer those patients to you? With every nuclear medicine PET facility, a big question is what is the tracer and where is it coming from? Other things that we want to think about is camera selection. What camera are you going to be using? Is that a PET CT? Where and what space do you have? Because a lot of times the space that you have available is going to drive what camera you'll be purchasing and what procedure you're looking to perform consistently as well. And then you want to look at the space and the build out, which we'll review some of these in a little bit more detail. And then you also want to make sure that you understand staffing requirements and that you provide and have a plan to provide the appropriate training and education. And then from a success point of view, it's imperative to make sure that you have your billing set up appropriately, you understand reimbursement issues that may arise, and then you have experienced staff who can help you optimize your billing and reimbursement process to ensure success of your program. And then not lastly, but probably one of the most important is ensuring that you have a marketing program, that you understand where those referrals are coming from, but you have a process to continually build, maintain, and build that referral base going forward into the development of your program. So first and foremost, it is extremely important to create a project plan that includes budgets and financials. You don't want to look at just 6 months out or 12 months out. You want to build a budget and financials that look 5 to 10 years into the future, that you understand what that baseline is going to be. In addition to that, your project plan needs to include all of the components for you to get started. And some of that can include, under required steps, is the plan should include timing that it'll take and the understanding of what permits and licensing you're going to need, not only from the radioactive materials license and nuclear medicine point of view, but also from a construction point of view. Are you zoned appropriately for what you're trying to do? What permits need to be pulled? Do you need an OCA or an occupational health permit from the state? and who are the parties involved where you would need to be applying for that. That is going to be very important. And that can differ from not even state to state, but city to city. So understanding your geographical location and what needs to be included so that you will have a successful launch. Secondly, it's the space build out. How much space are you going to need? Again, are you going to be able to choose the camera you want and build around it, or do you have an identified space and you have to look at what camera will fit into that space and what procedures you're going to be doing. And then the other thing you want to take into consideration is how long it's going to take you to hire staff. You're going to need, physicians, technologists, potentially nurses. So understanding the lead time, and also then that gets into what is the training time. Before you are ready to go live, you're going to have to hire your staff, and you're going to have to make sure that the staff has all the appropriate training and education to be able to operate not only efficiently, but appropriately, and that we're doing the right thing and providing the best patient care possible. And I have said this, and I will probably continue to say it, reimbursement, ensuring that before you inject that first patient, that you understand and have worked with each one of your different private carriers to ensure that this PET procedure and the isotopes are part of your carrier contracting, and make sure that you're assuring for the appropriate lead times to make that happen. I have seen labs fail after go live because this is the one piece they did not do ahead of time. And when they started submitting claims to their carriers, they started getting denials, or the carrier didn't have pricing in place to allow for reimbursement of maybe not only the imaging procedure, but also the isotope. So again, very important to understand and do that work ahead of time. And accreditation, submission, and approval. If you are an outpatient laboratory, do you need to be accredited? And if so, what accreditation body are you going to use to seek your accreditation? And sequencing this appropriate process in your project plan so you give yourself enough lead time to make sure that's done again before you start your first patient. And then identification again of referrals, and most importantly, in your project plan, in your 5 to 10 year financials, where are those patients coming from? What is your ramp time? Are you going to start with a few patients a day to start with and then build? Do you have more of a specific stream of patients that you know where they're coming from? And do you know the geographical constraints in your area as to is there a big employer in your area that has a specific carrier that they use to provide healthcare to their employees? And if they do, do you have contracting within that? Are those patients going to, based on their insurance, be able to come to your facility to get the care that they would need? And then as you start putting your plan together, the things that you want to think about that become very important as we look in a little bit more detail is, what equipment do you need to use, and building the equipment cost into the budget as well as into the project plan. What is the lead time it's going to take you to get that piece of equipment? So under equipment, you want to think about camera selection. You want to think about patient monitoring. Not only just how are you going to, if you need to monitor the patient's blood pressure, heart rate, or other types of kind of critical endpoints, what is that equipment lead time? What is necessary? Also, what processing and reporting software are you going to use? Do you already have that? Is that something you're going to have to secure? And have you done your due diligence to explore which might be best for the program that you're trying to build? And in addition to that, what display and pack system are you going to be using? How are the images going to be displayed, and where are they going to be stored? How is the interpreting physician going to have access to read? Are they going to be reading on site, or are they going to be reading remotely? And if they're reading remotely, do they have the equipment on their end to ensure the access into the system to be able to access the reporting software as well as the images to provide a timely report. And then hot lab equipment. With every PET program, you have to have a mechanism to log the doses in, assay them, and perform appropriate injection. So do you have a dose calibrator? Do you need survey meters? And again, understanding what is needed, what is the lead time of securing that equipment, and then building that into your project plan. When we talk about staffing, well, first and foremost, we need an interpreting physician, a medical director who's going to be the primary oversight for your PET program. So do you need one physician? Are there going to be multiple physicians? Again, under staffing, are they going to be remote located? And if your interpreting physicians are remote, who is going to be your on-site medical director who will be responsible for oversight of your program? And ensuring that you understand what are the regulations and requirements in your area to what has to happen with oversight of that lab. The next most critical piece is your technologist. Hiring technologists that are credentialed and qualified to perform the standard PET studies, that understand how to set up protocols and provide all of the necessary components of running a successful PET program. Generally, these technologists should be certified by the NMTCB or the ART, or have a combination of credentials. And then who are your authorized users? Who are going to be the ones that are, again, who is that medical director that's going to have oversight for the daily operations of the lab, ensuring safe handling of your radiopharmaceuticals, and that overseeing all the policies and procedures, protocols, and has a primary sign off on all of the daily operations of the lab. Are you going to employ a physicist? When you have a PET program, there is a plethora of quality control and other programs that you have to have oversight into it to ensure that the camera is always functioning appropriately. Are you going to have, based on your volumes and number of cameras, are you going to have a full-time physicist? Is this something that you're going to consult with, have a consulting company, or a per diem or a part-time, but who is going to manage the oversight of ensuring proper performance consistently of your imaging system? And then who is going to act as your radiation safety officer? Again, is this something that you will hire a full-time employee, or that you will hire as part of consulting services, but ensuring that that person is in place as you start to build your program becomes vitally important to ensure that you have all the parts and pieces necessary to have a successful launch of your PET program. And then again, who is going to be doing the coding and billing for the practice? Do you have in-house specialist? Are you going to, again, secure a consulting company who is going to assist with this, but ensuring again that takes place prior to the first patient injection goes a long way to ensuring that you have successful or optimized reimbursement to have a successful program. And then understanding where you're located. Is this a location where the patients are going to be coming into a practice? Is this going to be a standalone facility? But having somebody available to, as simple as answer the telephone if somebody has a question or is calling about their appointment. And then having schedulers who are responsible for ensuring that the patients are scheduled in a timely manner, that the patients understand any required patient prep that they will need to follow prior to, and to just ask be able to answer any general questions for the patient to make them feel at ease prior to coming to their appointment. So although these seem simplistic, these are the areas where I've seen we focus on the technical aspects of what we do, and we forget about all the ancillary. So all these parts and pieces become very important to driving a successful program. And when you're looking at doing your space build-out requirements, first and foremost, it is very important to understand where you're going to install your camera. What is the room size and location? and making sure that includes your control room. With your control room, if you have CT as part of your camera, do you have the right shielding that is necessary as part of that control room build itself? And then if you're going to be on the second floor, the third floor, what do you have floor loading capabilities? What is the capability or the capacity of that floor to be able to withstand the weight of the camera? And a lot of people forget that it's not just the camera, it's the camera with the control room, with all the other ancillary equipment, with the chillers and the other things that may need to be in that room or in that space that provide weight-bearing potential issues. So ensuring that you have those specifications from the manufacturer and that you ensure that the room where you're going to be putting the camera, not only from a space perspective, but from a weight-bearing capacity, has the capability of housing that equipment. And then how will the scanner get into the space? Is it a brand new space that's being built? Is there windows and walls that aren't in yet that we can put the camera in first and then build the walls around it? Or is it a piece of equipment that's going to have to be rigged and brought in through a window where windows will have to be removed? This all becomes important as part of building your program because it will extend the timeline and it could potentially add expense. So understanding how that's going to happen up front goes a long way to not running into issues as you start to build your lab. And then hot lab placement. Where is the hot lab going to be located in relation to your camera? Do you have space to have it located near the injection areas, which become important from an efficiency and timing point of view, and what areas have to be considered restricted or radioactive based on where you're going to be placing doses. And then that leads into the next, where are the patients going to be injected and where are they going to be waiting? What procedure are you going to be performing becomes very important based on being able to develop where these areas are going to be placed. So with most PET procedures, you need to inject the patient and then hold them in a quiet room for the uptake time, that 60 minutes post-injection, while we're waiting to put them under the camera. So ensuring that if it needs to be a quiet space, you have it, but most importantly, if these patients are waiting radioactive and you have multiples of them in the same location, what is the radiation exposure to the ancillary staff on the other side of those walls? Where is this injection waiting area going to be placed in relation to other staffing functions? Is your administrative staff on the other side? Is your billing staff on the other side? And then if necessary, ensuring that those walls are going to be lead lined or shielded so that you're not creating any unintentional exposure to ancillary staff who might be close or adjacent to that space. And then to that point, if there is ancillary staff in the adjacent space, what shielding will be necessary and what walls or where does that need to be put to ensure that we're keeping radiation exposure for any personnel as low as reasonably achievable? Next item on your list of things to consider is what tracers will you be using and where will they be coming from? Do you have a radio pharmacy that's located close to your facility? Are they coming from a few hours away? What is the schedule of production based on the pharmacy that you choose and what isotopes you're going to be using? All of that becomes extremely important to understand if there is any obstacles that you may run into on a daily basis getting your dose. What is the availability of the doses that you will need? Is there a specific time? Can the radiopharmacy only give you these specific doses at 10 o'clock and 11 o'clock or 2 o'clock and 3 o'clock? So understanding those supply chain logistics prior to starting your program, again, becomes important to building your schedules and to ensuring that you're not going to run into any patient delays post go live. So working through that again and building all this into your project plan, into your financials and your pro forma as you look in the beginning into the future. And depending on the tracers, is your radioactive materials license, first and foremost, do you have one? If not, going through those appropriate steps to secure one, and what is going to be the timeline in order to have that radioactive materials license active. Who again is going to be the authorized users on that license for that particular facility, and ensuring that you understand your local and state requirements to meet the application and deadlines and timing you will need to be able to get your go live done in the time that you're anticipating. And then another thought is there an injection method that you would prefer? Are you going to have your technologist do manual injection, or have you considered the possibility of using some injector or other ancillary equipment to assist with injection of the radio tracer? If you're going to use an injector, there's generally a cost associated with that. So ensuring that equipment and planning, budgeting for that cost as part of your capital equipment becomes important as you move forward. If you're not an already established nuclear medicine or PET facility, how are you going to manage, how are you going to build your radiation safety program? This is, again, another requirement to have a PET lab. So who are your authorized users? Who are going to be the ones responsible for the oversight of your radiopharmaceutical injections? Are you going to hire a full-time radiation safety officer? Are these going to be consulting services? And then building all of those policies and procedures prior to go live. All of that information will have to be secured and in place prior to being able to receive your radioactive materials license and prior to being able to go live with your patient protocols. So ensuring that you have all this information in place and that your radiation safety program is built will go a long way to allowing you to be successful in receiving those isotopes and having the appropriate plans in place to handle injections and receipts and everything that goes along with a safe handling of radiopharmaceuticals. And then as you're building out or getting the construction done and waiting on that lead time for your camera, have you built your imaging protocols? What protocols are you going to be using? How have you developed them? And then what documentation do you need to have those protocols available for use? Do you have the appropriate reference material to support those protocols? Documentation, doing your research, understanding what other people or other facilities with similar equipment than you has, so that you can optimize your protocols to the isotope that you're using and to the camera or the imaging system that you're going to be using, so that you have the highest image quality possible, and that from an accreditation point of view, you are meeting those requirements for your billing and reimbursement purposes. So getting those done ahead of time to have available to submit for whether it's accreditation application or as part of your radiation safety program submission, that you have all of those in place. And again, ensuring that you have a medical director who will allow for appropriate protocol review and sign off prior to injecting that first patient, so that you will be ready to handle any potential issue that may arise as you get ready to start your program. Some of the other logistical things you want to think about in starting your program is scheduling. What is your schedule going to look like? So it's important to understand where the patients are coming from, but then it's also important to understand what is the availability of time and scheduling. We always want to make sure that we are scheduling our patients in a timely manner. And standard labs now, we're hearing that in order to be successful, you want to be able to schedule your patient within 7 days of the time that orders come in. So what are your protocol times? Understanding how much time you need to leave between each time slot. Is it 45 minutes? Is it an hour? Is it 30 minutes? Depending on the protocol, to allow for the technologist to be able to do appropriate injections, to be able to turn the room around so that it is sanitized and safe for the next patient to come in. And then in addition to that, what is your availability of staff? When are the physicians going to read? How many technologists do you have? Do you have a nurse? Do you need a nurse to perform any supporting or ancillary roles? And what are your hours of operation? So you can build that schedule and have it airtight prior to the first time you turn the phones on. And remember that if you're plan to go live with your first patient, say on a June 1st, you want to make sure that you have your schedule in place and that your schedulers are in place at least 30 days prior, because you need to have the scheduling process take place before your first patient can be scanned. Otherwise, we won't have patients to scan. So it's these little details that become very important and that will really drive success of your program by ensuring that this is all understood and laid out prior to your go live and as part of your build. And then again, marketing plan and referrals, identifying the referral base. Who are going to be your primary referring physicians? Is it a combination of specialists? Is it neurologists? Is it oncologists? Is it internal medicine physicians? Again, do you have a memory clinic or some other clinic that is going to have a big referral base for you? And then developing a marketing plan and collateral to use to help go out and educate the referring physicians. So having a plan in place prior to your go live to inform the referring physicians of your intent or the start date of when they can start referring patients, and having the appropriate educational materials available to help educate them about the benefits of where PET is placed in relation to other testing to help drive appropriate care and treatment of their patients. And then ensuring that they not only the pre to get them to refer your patients, but you also want to develop a plan to track referring physician satisfaction, because you can get a physician to refer a patient once, but if they aren't satisfied, they may not continue to do that. So you want to maintain your referral base. So having a plan in place that allows you to do that, having a marketing specialist who can continue to do that, follow up with your referring physicians after the first few procedures that they've ordered, checking in with them to ensure, was this patient scheduled in a timely manner? Was the report helpful? Is there anything you can do differently that will help the referring physician experience to ensure that you have a successful referral base to help drive program success? And then, as I mentioned, coding and reimbursement becomes extremely important. First and foremost, ensuring that you understand prior to going live, what are your carrier contracts? Are you in a situation where PET procedures are part of your current contracts, or if you're new, securing these contracts with the private carriers to ensure pricing and reimbursement is in place, and understanding what their pre-authorization policies are for the procedures that you'll be performing to ensure success, not only from your perspective, but so that you can help guide your patients through this process as necessary. If you were going to be participating in Medicare, ensuring that you have prior CMS approval. So whether you're an IDTF or a physician practice or a hospital, ensuring that you have all of these in place for your IDTFs and your physician practices, making sure that you've completed Form 855I or 855B with the Medicare carriers ahead of time to ensure that you will be allowed to submit these claims and get reimbursed for these claims. So if this is a new program, starting this process as early as possible is going to be extremely important to understand that when you start submitting those claims, that you will get timely reimbursement. I have seen in situations where this paperwork or this approval hasn't been done ahead of time, and it has delayed reimbursement for the practice up to 18 to 24 months while they're working through this CMS approval process. So can't stress enough how important this piece of it is, and having all of that in place prior to doing any insurance claim submissions to not delay payment of claims on the back end. Because if the reimbursement is not coming in, it makes it harder to drive being successful in the rest of the practice. And then having experienced staff who understands what needs to be done, how it needs to be done, and then understands how to work with your carriers to get appropriate payment policies in place, again, prior to go live. And that you understand what the appropriate CPT codes are, and that you have an appropriate charge master and pricing in place prior to, again, your go live, so that this does not cause delays after you scan your first patient. From the technologist point of view, just understanding, is it a PET-only camera, or are you thinking about using CT? If you're going to use CT, who's going to be performing that CT? Most importantly, understanding your state regulations for technologists. Is there licensure, and what does that licensure say? And then from an imaging standpoint, I've talked about how important it is to educate the referring physicians and how important it is to have a good coding and reimbursement staff in place. But the final piece of this is ensuring that the technologist physicians and, again, your referring physicians have all the appropriate training and education ahead of time, so that procedures are performed appropriately, that the physicians understand any potential normal variant pattern in the isotope you choose to use, so that everything is in place prior to that first patient injection, again, to ensure success of that program. So just some quick overviews when we're thinking about staffing considerations. As I mentioned, your authorized user, a medical physicist, technologist, a nurse to perform any supporting roles if there's any medication that will need to be given, if you need to have a nurse on site, if dealing with claustrophobic patients, sedation or other things will need to be administered during the actual procedures, or to monitor the patients post-procedure. And then your radiation safety officer, who's responsible for maintaining your radioactive materials license and adherence to all radiation safety policies and procedure. And your authorized users, again, can be a radiologist, a nuclear medicine physician, or other credentialed individual that allows for general oversight and success and safe handling of your radiopharmaceuticals. And then on the ancillary staffing end, again, having very well trained schedulers who understand how to migrate through the pre-authorization process when applicable, to understand all scheduling needs of the patient and any pre-auth and any preparation that the patient will need to go under, and are versed in being able to answer any patient questions. And then your medical coverage experts, again, it's important to have these experts to be able to have a deep understanding in billing and coding to guarantee success of your program. When we talk about space, there is a multitude of different cameras, different sizes, different shapes. So understanding what your camera is, how that's going to fit into the space, and all those logistical concerns that we've talked about. So with floor space and consideration, again, as a reminder, where's the waiting room and injection areas going to be placed in relation to the imaging area, injections in relation to ancillary personnel, hot lab, what space is going to be required? Do you need a control room? How big is that going to need? And most importantly, shielding. Putting the shielding in while the room is being built is much easier than identifying an issue post go live and then having to tear walls down to put extra shielding in, not recognizing that there was ancillary staff sitting on the other side of that wall. So we'll save you time and effort, and will allow a more successful program if all of these things are put into place prior to your go live. Any other considerations for CT if it is going to be used as part of a PET CT program? What quality control has to take place? What areas are going to be identified as restricted radioactive areas as opposed to general common areas, so that you can have signage and other things placed appropriately as you're building out your space? And then considerations for radiation safety and radiation exposure, again, being able to identify restricted versus unrestricted areas and what staff can be in what locations based on what's going on and what vicinity the ancillary staff is compared to all of your restricted areas. This is just a sample floor plan that can help. It would be a bigger practice that had two imaging facilities, two cameras. Then we look at our waiting area, our patient consult room in case the physicians will need to have a conversation with a patient or if there's any patient questions. Always better to add this space in ahead of time versus trying to find a quiet or a safe space to do patient consults in post go live or shifting them around. Your imaging equipment area, where this space is, what is going to be housed in this space. Your treatment and injection rooms, where are your injections going to take place, where are your patients going to be injected, and where are they going to sit and wait for their imaging study during that uptake period, and then what other procedures are you going to be providing or medications that you may be having to give in conjunction with, and do your nurses and other personnel have an area to be able to perform these functions. Having a nurse workstation, if you are going to have a nurse for any reason to do his or her documentation during the procedure. And then again, our hot lab and radioactive storage areas, and having these all in the appropriate location and understanding what shielding needs to go up in each one of these rooms as you're building out your floor plan. And then radiation safety considerations becomes very important, cornerstone to everything that we do when we're dealing with radioactive materials and this handling of and the safe handling of radiopharmaceuticals. So again, knowing where your ancillary staff is going to be located when considering building a new program. We want to also minimize exposure during acceptance and assay of our doses, injection of the patient, uptake and wait times for the patient, and imaging of the patient, including CT if being used. So ensuring that your radiation safety program takes all of this into consideration. And looking at kind of the basic principles as what are our external exposures, and do we have the appropriate shielding, syringe shield, vials, where's our waste and storage going to be if we have that, and making sure that we're reducing whenever we can. Again, patient uptake and waiting, where is that patient's dose going to be administered and where are they going to wait to ensure that we are not exposing unnecessarily any ancillary personnel depending on the location. And then internal exposure. So operating procedures we need to make sure that our radiation safety program and our operating procedures meet all local and national regulations in preventing any unnecessary exposures. And then understanding what type and building those plans based on the type of radiation that you will be administering. This is just a general schematic that looks at the different types of betas, gammas, and what penetration happens at what levels. As we know with our gammas, those have the kind of the farthest length of reach based on their travel distance time and what is useful to kind of stop them. And we know with gamma, we need concrete, we need lead and other things depending on how far the distances they're traveling. So again, ensuring that we have the appropriate shielding in the appropriate places to eliminate any unnecessary exposure. And then ensuring that you have the right thickness of shielding in those locations as well. And this is just one depiction. If we look at the different isotopes, if we look at our fluorine-18, we know that our 10th value layer for fluorine-18 is 13.7 millimeters of lead. And this is from references that are easily accessible when you are starting to develop your program. And again, our half value layer in millimeters of lead for 511 keV is 4 millimeters. So ensuring that we have the appropriate not only the appropriate shielding, but the appropriate thickness of shielding in the areas where they are required. Also understanding dose delivery and storage, depending on how many patients you're going to be doing in a day. As we look, we know these containers that are radioactive doses get delivered from the pharmacy in are rather big. They are in lead line, tungsten, or tungsten mostly cases, and can be heavy. So what space, where are these going to be put? Making sure that there is the appropriate shielding in those locations. It is restricted area. And another thing to keep in consideration is proper body mechanics for your staff who is checking in and picking up these packages. They can be heavy. And making sure that they have the appropriate mechanism to move these and handle these. I have seen over the years multiple back injuries based on just the weight alone of picking up one of these cases when technologists have not been trained in appropriate handling of the actual, not necessarily the radiopharmaceutical, but the actual case itself. So in order to avoid ancillary back injuries or other ensuring that the technologists are also trained in the handling dealing with the weight of the cases. And then when we're setting up our hot lab, ensuring that we have the appropriate shielding. Again, we have the appropriate rings around our dose calibrator, that if we're preparing doses or putting doses into syringe shields, we have the appropriate lead and glass for the technologist to work behind as they're calibrating that dose to ensure, again, minimal radiation exposure through this process. And this is just some more images of kind of safe handling for the technologist of things we want to consider. And again, important to identify this need ahead of time, because this is all part of your capital purchase prior to starting the go live of your patients or your program. And again, making sure that the technologists are trained in safe handling of your radiopharmaceuticals. If we look at this depiction here, looking at radiation exposures, if we're holding the syringe in our hand, if we hold it at the tip, and then what happens to radiation exposure as we just hold it with a pair of tongs or tweezers. So again, importance of having the technologist and staff trained appropriately in safe handling of radiopharmaceuticals to minimize exposure to all staff. So critical for administration or criteria for administration of radiopharmaceuticals, we need to have a dose calibrator to measure activity and ensure that there's no cross contamination or other equipment. We want to ensure that we have a quality assurance program in place that allows for standard operating for a dependable, safe and accurate reproducible equipment, as well as clinical administration of radiopharmaceuticals. Quality control systems in place to meet performance specifications and provide baselines for comparison. And we always want to make sure, as part of the quality control, we're following all local, state and national regulatory guidelines that are necessary. Making sure that we're set up for any adverse reactions that patients may have or experience as part of the administration of the radiopharmaceutical or other pharmaceuticals they may need during their stay at the practice. And then ensuring that we have point of care monitoring. So again, it's making sure that we have the right equipment and the right tools. They're easily accessible so that as part of the program, you can handle any issue that may arise, and that you've had the forethought prior to be prepared for any of these potential things that could arise. So ensuring stability of your program, as well as setting baselines so that if there is a variant, it will be easy to identify as you move through the process. And then again, injection of the patient. making sure that you have appropriate syringe shielding, that butterflies or IVs are available to gain access as necessary to minimize infiltration of dosing or any activity being located under the skin rather than in the bloodstream of the patient. Making sure that technologists are trained to maintain a distance once the patient is injected, and then consideration of an auto-injector to help with decreasing radiation exposure. Again, all of these are components that you want to make sure are built into your budget, whether it's your capital budget, and that are secured prior to your go live of your program. And just for shielding, making of the actual radiopharmaceutical itself, ensuring that you have the appropriate shielding for PET tracers. When you look at the difference between the lead syringe shields we use for technetium compared to the tungsten that we use for F-18 and other tracers, again, making sure that we have the appropriate equipment to guarantee radiation safety of our employees as well as our patients. And then again, education of the practice of staff, of patients, and others. So from a practice point of view, understanding what those new referral patterns are going to be and what the imaging requirements are to have a successful program. Ensuring that all staff is trained and educated, your imaging staff, your billing staff, your scheduling staff, and any other ancillary staff that you will have prior to your go live to ensure successful launch of your program. Your physicians, your healthcare providers referring to your practice, they are educated, they understand where the procedures you're going to be performing fit into their patient's care and treatment, and that on the interpreting physician side, that report is complete and that it provides a method for the referring physicians to make clinical decisions on their patients. Making sure we have education available for our patients, benefits of the imaging procedure, to allay any fears of the benefit of receiving a radiopharmaceutical compared to the risks, having patient brochures set ahead of time, having patient prep instructions on a brochure that's easily to disseminate and easy to understand for the patient, that it's written in a level that the patients can understand and isn't too heavy clinically written to cause confusion for any patient that receives that instruction, it's easy for them to understand and read. And then what is your position in the community? Being able to market your program and the accomplishments that the practice has already seen, and where that having this access to this procedure available for patients, the importance of that in the community itself. So multiple components of education and outreach that need to be done, not only prior to the go live of your program, but also kind of after, to ensure continued success of your program and to build referral volumes. And then again, billing and reimbursement, critical to the success of the program, ensuring that you have appropriate experienced staff necessary to ensure optimal reimbursement, working with the carriers not only prior to have contracting set up prior to go live, but ensuring that communication continues to happen post go live, so you're always ensuring optimal reimbursement for the practice, and making sure that you have that appropriate CMS approval and MAC pricing in place prior to the completion of your first patient to ensure for seamless claim submission and payment receipt. So when we're talking about reimbursement claims considerations, you want to make sure that you have all the appropriate PET procedure codes in place on your charge master or as part of your billing process, that you know what the invoice price of that radiopharmaceutical is, and you have a mechanism to provide that to the carriers or to CMS as required based on your submission claims, that you have all of the documentation to support medical necessity for the codes being billed. What is the reason for that PET procedure and ensuring that it meets medical necessity. If you are a hospital, ensuring that all of your appropriate revenue codes are built appropriately, that you have a principal diagnosis, your ICD-10s, and then when necessary, also having access and understanding what those secondary codes will be in order to ensure appropriate documentation on the claim for appropriate payment. When necessary, understanding what the radiopharmaceutical agent NDC code is as appropriate, and making sure that you are using the correct agent code or HCPCS code, and that on the claim, if it is billed by units, i.e. millicuries, instead of per unit dose, that your claim is reflective of how many units that patient did receive. And just for reference points, what I have on the screen is all of the standard PET imaging codes for both PET and PET with CT, classification of codes to use as a reference point, and again, ensuring that you're using the appropriate code based on the procedure that you perform on the patient. And then from a neurological point of view, all of the neuro agents that are currently available with their HCPCS codes as a reference, and again, ensuring that for your particular setup with your carriers, you understand how they want to see the codes, what that claim needs to be look like, and that you have all of them built in appropriately to your billing system, to your charge master, and that you've worked with your carriers to ensure that they pay for both the technical component as well as the HCPCS codes for the radiopharmaceuticals. So the necessary components to a successful PET imaging program, first and foremost, is having a program plan with success metrics built in. You want to start that from day one to get that program built. Make sure it has timelines, it has points of success, and points of things that have to be done prior to that go live. Understanding of your referral patterns and market outreach plan so that you have well-educated referring physicians as well as education for our patients. Assure that you have appropriate staffing to be able to handle the volume and the procedures that you would like to perform in your PET program. Optimizing imaging protocols and have all necessary equipment available to ensure proper implementation of these protocols, ensuring that internal education is done for all of your staff and that all of the external education is done for patients and providers prior to go live. And again, having a very strong coding and billing program in place and the appropriate educated personnel will all ensure appropriate education for your education and success for your implementation of your PET imaging program. So with that, I'm going to thank you all very much for your attention today.
April, thank you so much for this wealth of information. That's amazing. I think we still have time for a few questions here. So you outlined, obviously, and explained in detail the various steps quite a bit. What, based on your experience, usually does it take to start from zero to scan the first patient? So what's a typical setup time for such a program?
So I would say I would give yourselves at least 18 months. So if you think starting today, I want to build a PET program, it can take you a couple of months just to uncover where those referral patterns are going to come from. And then where I see people get stuck is in not allowing enough time for, depending on what construction or permits having to be pulled, allowing for permitting time and lead time for questions. So I always say, give yourself at least 18 months to be really ready to give yourself enough time to have an appropriate program. And to build for any of that lead time, to get all those success metrics built ahead of time, so that better to give it a little bit more time to start than to start too soon and then have failure points along the way.
Of course, make perfect sense. Now, I heard that there's a shortage on technical personnel in the US especially. Do you see this as a challenge, as a problem for someone who wants to start a new program?
We are starting to see this as a little bit of a challenge as we see PET programs growing in the United States. I know the Society of Nuclear Medicine and Molecular Imaging, along with the NMTCB and the ART, are working on methods to address the technology shortage, different pathways for education. But again, I would suggest starting early in the process to hire a technologist. First of all, it could take a little bit of time to hire one. And second of all, having that technologist available as you're building your program with their level of expertise goes a long way to ensuring that you have the right components in place ahead of time. But yes, be cognizant of the fact that that we're coming into a shortage, but there are support systems to help you kind of get through that.
Okay, excellent. Now, again, you outlined several steps. Would you pick one that you feel is the most difficult, most important one to consider?
Yes, the most difficult and the most important is having a strong billing process and understanding how to maneuver through the insurance kind of landscape. We know, especially in the United States, patients come from different backgrounds with different plans. And so working with each one of the carriers to understand, even so, I'm going to just throw one out there, like Aetna, for example. They could have 15 different types of plan in your area that you may see your patients coming in with, and what they're willing to, or what that process is for a patient to get pre-authorization could be different for each one of those. So we all know that one of the things that's going to make us successful is having the revenue come in once the program is operational. And so ensuring that you have that, number one, you've got the right codes, that the claims are being filled out appropriately, that they're done timely, and that your contracting is up to date with the private carriers, as well as understanding what is needed from the Medicare or your MAC in your area, is going to be so vital to the success of your program. Because if you inject that first patient and it's 24 months and you still haven't got injected for, I'm sorry, not injected, reimbursed for that claim or others, it's going to affect your financial success of the program.
Of course. No, it's well, thanks a lot. I think that's all for now. Thanks again for your time. Thanks for sharing all these details. I think it's a lot that someone needs to consider if someone wants to start. Still doable, obviously, and we are here as well to support. So thanks again. Have a wonderful afternoon. Thank you so much. Bye-bye.
Thank you too. Bye-bye.